Welcome back to Live at 9, and it's Dr. Quinn, Mississippi's favorite doctor. And Dr. Quinn, we're talking about when medication side effects go right. How will that? Because usually all you hear is when they go wrong, but I want to talk about when they go right. So explain to me, when do they go right?
Well, there are times very frequently that people don't know about where medicine can be repurposed. It may be a medicine for, say, hypertension or pulmonary hypertension. It was discovered that a lot of people on this medication had improvement of a problem with relations with their spouse. They didn't anticipate this when they started the medicine, but this was a side effect. And the company Pfizer, they were so interested, they did clinical trials to make sure it was safe, and it really did correct that problem. And they were able to get the FDA to repurpose the medicine specifically for relations with the wife. And this medicine is Viagra. That's how Viagra came about. It was initially a medicine for pulmonary hypertension. It was discovered that it helps with relations with your spouse, and now we have Viagra.
Yeah, well, we'll move on from Viagra just for a moment. But tell me, how often does this happen? I mean, is this a regular occurrence? I mean, is it as often as when it goes wrong?
It certainly is. The latest medicine right now, the weight loss medicine, Wegovy and Zepbound, were initially developed to treat people with diabetes, but it was discovered that a lot of these individuals on this medicine, which were Ozempic and Mounjaro, were losing a lot of weight. So the companies, Eli Lilly, they repurposed the medicine after research, which I participated in at our clinic, for Zepbound, which helps people lose weight even more than not taking the medicine, of course. And it was determined it was clinically safe and very effective. And now the FDA has repurposed that same ingredient, trizepatide, for Zepbound, and people are losing weight.
Is there ever a concern when people get these side effects that they quickly rush to it, maybe before some of that research is done? Because I think, you know, when you talk about some of those weight loss things, I think people rush to them really quickly when they heard that their friends were doing it, and then the medicine caught up and the research caught up. Is there ever a concern that maybe you should wait for the research?
There is a concern. That's why individuals that get on the medicine can't just buy it over the counter. They have to go and see a medical physician so we can properly monitor the medicine and make sure that they are tolerating the medicine as an individual. Because with side effects, some people will have the side effects with certain medicines and some people won't. That's why if you think about Tylenol, some people could develop liver problems. That's why if you take a lot of different medicines, you need to follow up with your medical provider to make sure you're properly tolerating the medication without all the side effects that could be harmful.
Yeah, and let's dig a little deeper in that. Is there ever just an individual basis where the side effect goes right, and maybe it's not a universal medication for everyone, but for that specific person, this medication seems to respond with their body very well? Because, you know, my brother has autism, and they change his medication all the time, and then there's sometimes good side effects, and then those side effects kind of waver away.
Right. It's always an individual scenario with every patient. That's why, like, if I walk out of here right now, the waiting room has a lot of different people in it. I'm going to see each individual person as an individual and look them in the eyes and go over their blood work and talk to them about their response if they're on medication that we've prescribed here. Every individual has a different metabolism, a different genetic predisposition, and a different possibility of responding a certain way to a certain medication. It's always the individual. So everybody should follow up with their medical provider so that they can be in the safest, most effectively treated position possible, as they deserve.